Hi, everyone. My name is Jane Meisel. I'm an associate professor of hematology and medical oncology here at Emory University, and I'm delighted to be presenting today some of the highlights from ASCO 2021 on metastatic breast cancer. The talk is divided into ER-positive, triple-negative, and HER2-positive updates and focuses on the abstracts with the most significant clinical implications for your clinic right now. The first two abstracts we review were MONALEESA-3 and PALOMA-3, showing updated overall survival information from these trials, and really showing that the addition of CDK4/6 inhibition to fulvestrant does indeed improve survival for patients with ER-positive metastatic disease, with benefits most significant in those with endocrine-sensitive illness. The next study presented was DAWN-01, which looked at a novel CDK4/6 inhibitor called dalpacyclib, along with fulvestrant, and found that, like its predecessors, it too improves progression-free survival versus fulvestrant alone. We then go on to discuss some updates from the Ascent Trial. There were three important posters at ASCO. The first focused on patients over 65, finding that sacituzumab govitecan did indeed improve progression-free survival in this population, but that proactive adverse event management is important, particularly in these older patients. The second study showed that sacituzumab has a significant progression-free and overall survival advantage when used in patients who recurred less than 12 months after adjuvant or neoadjuvant therapy, so really our most chemo-resistant population. Then another poster looked at the efficacy of sacituzumab compared versus each individual chemotherapy agent studied in the Ascent trial, and showed that the efficacy benefit of sacituzumab was maintained when evaluating against each chemotherapy individually. After that, we move on to talk about HER2-positive disease, and a really important study coming out of Asia showing that when randomized to trastuzumab plus endocrine therapy versus trastuzumab plus chemotherapy, the patients on the endocrine trastuzumab arm did just as well, with no difference in progression-free or overall survival, and in fact, a numeric benefit for the endocrine plus trastuzumab arm. The authors also showed that this combination was most likely to benefit patients who had a longer disease-free interval, greater than 24 months. So something to think about as we further individualize treatment for our patients. Finally, we move on to discussing the Patient-Centered Dosing Initiative, a group that did a survey of over 1,000 patients with metastatic breast cancer and showed that patients are very open to dose reduction for side effects, and that for the vast majority of patients who receive a dose reduction, it's extremely helpful in terms of improving quality of life. This study really highlights that personalized treatment in breast cancer, which is all the rage these days, is not just about genetic or genomic characteristics and targeted therapies. There's also individual responses to treatment, how patients are feeling on treatment, and understanding patients' goals. I think it's important to remember that treating metastatic breast cancer is an art and a science, and keeping the patient at the center of our decision-making and our discussion is the key to our success.